Hello, I'm Dr. Arshnoor from DR.ARSHNOOR'S OET Institute. I'm the person blessed with both the qualifications, that is medical and English. I'm basically doctor by profession, and after that I did master's English, MPhil, and I'm the sole qualified, that is teaching English to a student of foreign language. Above all, I've been teaching OET for the last uh, 8 years, that is since 2014. It was actually originated in 2013 and I started teaching OET in 2014. So since then, there are more than 1,000 students who have cleared OET from my side. So now I'm going to start with some of the topics. It may be live or I'll be sending the videos so that my students should get some information and help while attempting their test in the exam. So let's start with one of the speaking tasks today. So this is the task that hospital setting. It is a hospital diabetic clinic and this is the nursing task. Nurses, your patient is 60 years old. It may be male or female, you can decide it accordingly. And it has type 2 diabetes and which has presented to the clinic with the severely infected left foot. There is a lot of redness and swelling. Now, so first of all, we do know that we have 3 minutes to prepare the task. So it is my suggestion to all of you that you should utilize those 3 minutes properly. First of all, read the task properly. Then you should prepare the important points, the notes from this, and after that prioritize the information. That means, first of all, what you have to ask the patient, this must be prepared in that particular 3 minutes. And here it's an option that you may ask the name of the patient, that will be the examiner, in the 3 minutes, or it may be while you are attempting the task. So now let's see how we have to do this. So your patient is 60 years old with type 2 diabetes and it is infected foot. You have to first of all ask about the details of the cut, and then you have to explain the patient about what information or what advice or the treatment is required. So here it is written that the already the patient is late, as this is said that firmly explain that your patient has left it very late to seek treatment and this can result in the ulceration and possibly amputation if left untreated. So in the first part, you have to tell the patient clearly about this thing, that he is already late, and if at this time also if the he is not treated properly, it may lead to amputation, which may be the adverse circumstances or the worst consequences of this. And now you have to reassure the patient that appropriate medical care will be given to the patient to treat the infected cut by dressing and the antibiotics. Now let's start with the task. So first of all, you have to greet the patient. You may say that, hello, good morning, good afternoon, according to the timing. So I guess it is better to say, hello, I am. So you may name yourself that if what's of your name. So I am dash and dash or registered nurse working in this hospital or this diabetic clinic. Or one of the registered nurse says, if you're saying that one of the registered nurses, in that case, you have to use a plural. Don't say I'm one of the registered nurse working in this suburban clinic or diabetic clinic. Then you should start by asking the patient, how would you like to be addressed or how may I help you? So then if the patient interlocutor is telling you that I have this problem that my foot has infected wound, then you should take a pause by saying that let me examine it first. After examining, you should tell the patient, oh my God, it is already too late. I'm sorry to tell you that if you do not take it seriously, you may have to face dire consequences or it may be the adverse effects that may lead to amputation. So obviously the patient will become concerned about this, because no one want any part of the body to be amputated. So then you may continue with the task by asking the information. See students, information gathering is a very important part in OET speaking. So you have to gather the information by asking the questions related to this. That is, first of all, ask the patient about the history of the wound. When did he first saw this? When did he first see this wound? Then the patient will tell that it might be 10 days, 15 days, or a week. Then you have to ask the patient whether he tried to treat it with something. It may be he applied some antibiotic, antiseptic, or did some homely remedies. Then you may ask him, the patient, for how long the patient is diabetic. Then after getting the information, then you may start with the suggestions or the advice given to the patient. Here it is important for the patient to have a proper compliance with the medicine. Then now the proper dressings. So dressings are very important, because in that case the wound will be cleaned every day, and after that it will be dressed properly to avoid any type of the further infection. Now, what are the other suggestions given to the patient? That he or she should wear stockings to avoid any another further cuts, and he should toenails trim and cut across toenails properly. So this is very important, so that the patient should not have such injuries in the future. He should trim his toenails properly. And then after that, you may tell the patient that his stockings needs or socks needs to be changed every day. One thing very, very important, that he should not wear the shoes or the footwear which are either very tight or very loose. So then you may talk about the diet also, that he should have a diabetic restricted diet. In this way, we have the three parts of the speaking. First of all, how to dress the patient. And first of all, after addressing the patient in a proper way, you have to tell about the situation or his condition. As in this case, we know that the patient has come late and it is already too much infected wound, and if at this time it is not treated properly, he may have to face unpleasant consequences. This is to be informed to the patient in the beginning of the task. So then comes the information gathering. That is the second part. You have to ask certain questions related to this. It may be for how long he has been suffering from diabetes. Then it could be, when did he first see the wound, what did he did with that, and now what does he feel, whether he's feeling any pain or this or not. Usually the diabetic wounds do not have any type of the pain. Then you may ask about his occupation, because it may be related to that. If the patient has some occupation that he has to stay standing for a long time, or if he has to walk for a long time, in that case you have to tell the patient to avoid walking for some days, so that the wound should be healed properly. And again, it's important for him to use or wear proper shoe fit to avoid friction or stress or any pressure source. In this way, after telling the patient about the suggestion for this task, you can end up by saying, hope to see you in a good condition, or Mr. whatsoever, let it be the name of the patient, me David. David, you have to be careful about your wound, and do come for the dressing tomorrow. Let's see how much cure you have got, or how much improvement you get in your wound. Hope to see you in a good condition. Thanks for coming to me today. In this way, you can end the task. So see students, usually in the OET speaking, we have two tasks, two role plays, and in both the role plays, you have to be conscious about the question information gathering part and suggestion giving. Try to give some different sentences, different words while attempting both the tasks. Thanks for watching. Stay connected. Happy learning. See you with new video.